pandemic on Mobile County. So worldwide, there are more than 65 million cases of COVID-19 with 1.5 million deaths. In the U.S., we're approaching 15 million cases with way over 250,000 deaths. And in Alabama, we have more than 250,000 cases and 3,831 deaths, so nearly 4,000 deaths. Dr. Scott Harris has said a couple of times this week that for the past 3 or 4 weeks, Alabama has added 1 million cases of COVID-19 per week. So we are definitely in a alarming rate of accelerated transmission throughout our community, and we're seeing that in Mobile as well. So for Mobile today, sorry, I have too much paperwork here in front of me. In Mobile today, we're reporting on 20,730 cases of COVID-19. Yesterday, 186 cases were added. On Wednesday, 156 cases. And on Tuesday, the highest number of cases reported for us since July, 196 cases. So if we look at the last week, nearly 1,000 cases of COVID-19 have been reported in Mobile County residents. And again, these are just the ones that we know about. We know that for every case, there could be as many as 10 that go unreported or undiagnosed. And this is an alarming rise. It's not a complete doubling, but approaching a doubling of the number of cases reported the week of Thanksgiving. So again, just alarmingly high rates of transmission. We have had 375 Mobile residents die with COVID-19. That's an increase of 2 since yesterday. The cumulative number of people hospitalized almost at 2,700. And then the daily number of people hospitalized with COVID yesterday was 105. And this is good news because we had been in the 120s, almost reaching 130 people in the hospital on Monday, and it's good to see that number drop back down. You know, in the spring when COVID first came upon us and we moved into a safer at home order or protocol, we did that because we were really trying to slow the spread of transmission, to flatten the curve, to give our scientists and our healthcare providers some breathing room as not to overwhelm our healthcare system, and to give our best and brightest scientists time to develop therapeutics, treatments, vaccines. And it seems that we didn't know it at the time, but we did a pretty good job of that back then. You know, we had a peak in July. Our hospitals did not get overwhelmed, and then we saw some pretty low levels in late summer. But with the fall season, returning to classes, restrictions lifted on things like alcohol consumption and the size of gatherings, and limits on patrons in restaurants and businesses, those sorts of things, we've seen the numbers rise to what we had feared back before summer. So it's going to be a rough go for the next couple of months, and we need your help to try to continue to keep the transmission as low as we can to try to, again, not overwhelm our hospitals. In the spring and early summer, hospitals were limiting elective procedures, were, greatly limiting people coming to the hospitals. And most of that was in an effort to try to conserve personal protective equipment. We didn't want to run out of gowns and gloves and masks. And now what's really putting a hardship on our hospitals, their ability to care for COVID patients, or any patients of that matter, is really is going to have to do with shortages in staff and in beds. We have to have staff to man those hospital beds so that we can continue caring for people who need hospitalized care. So it's still really important for us to try to slow transmission as we continue to try to, beg for your help to allow our hospitals to continue providing care, and for the scientists to continue working on the safe vaccine and safe treatments for COVID. So a couple other things that I often report on Friday about our number of complaints. So we've not had many complaints this week. 2 in a restaurant, 2 in a retail establishment, a few in schools, and a detention center. We still have outbreaks going in about 6 nursing homes, a couple of assisted livings or other types of long-term care facilities. But the news is better there. The nursing homes seem to be in a better place this week than they were last week. So we're going to continue working really closely with them on that. Let's see. So we have some questions and a couple comments that I wanted to make. You've heard a lot about pre-positioning vaccine and early shipment of vaccine and that sort of thing. We have learned yesterday and today that there are 15 hospitals statewide and 5 locations in Mobile County that will receive vaccine on the first allocation as soon as the Pfizer emergency use authorization is issued, and the ACIP makes their recommendations and CDC reviews them and approves them. Then Pfizer vaccine will ship to 5 locations, 5 hospitals in Mobile County, and additional allocations of vaccine will come shortly after that. The hospitals, the allocation, the vaccine that's going to the Mobile area hospitals, the state is recommending that half of those be used for hospital and their staff, a percentage set aside for skilled nursing facilities or nursing homes, some for physician offices, and some for emergency medical service personnel, or traditionally, those first responders that come really face-to-face potentially with COVID patients. And then quickly, as more vaccine becomes available, we'll continue on those high priority vaccinations, and then roll through the phase one, what we call phase 1B, phase 2, and phase 3 over the next months and years as vaccine becomes available. So a couple of things with regard to questions. So we have just a few questions from the media today or from Facebook. So the one from Facebook says, how much higher do the cases need to get before we shut down again? We likely will be a surprise if we see just total shutdowns. There will, when we started in the spring going into the summer, we sort of gradually put things into place to limit the spread of COVID-19 virus. And we didn't sort of do everything at once, which is what I think of as a shutdown. And instead, we did, implemented some things in a rolling fashion, sort of getting a little bit more and more restrictive as we moved along. And then after we got over that first peak, we sort of started pulling back those restrictions in a similar manner, sort of peeling the onion one layer at a time, so to speak. And that is the way things will happen over the next couple of months. So we have the Safer at Home order that requires wearing a face mask, physical distancing for people that don't live with you, and then those other public health recommendations of covering your cough, staying at home if you're sick, or if you've been exposed with COVID, washing your hands properly, that sort of thing. So it's really important at this point that we recognize that the way we are contributing to accelerated transmission of COVID in our community is through gatherings. So a gathering, as defined by CDC, is a planned or spontaneous event, indoors or outdoors, with a small number of people participating or a large number of people in attendance, such as a community event, a concert, a festival, a conference, a parade, a wedding, a funeral, a sporting event, right? We all know what a gathering looks like. Everyone knows, but people ask me all the time, oh, well, can I have a wedding or can I have a concert? Those are gatherings, right? Not only are they prohibited if they cannot maintain 6 foot of physical distance between people who don't live together, they are also a really bad idea, and that is the way that COVID is spreading in our community. So it's spreading in schools, it's spreading in after-school activities, it's spreading in churches. Even if you're having them outside, if you can't maintain that distance, you're promoting the spread of COVID. weddings, funerals, concerts. This is why parades are a really bad idea, and why public health officials are recommending that parades be postponed. So we all want to, people ask me a lot of the time, when are things going to get back to normal? Well, evidently they're back to normal for a lot of people, which is why we have such high transmission right now, which is going to make it a lot worse for those of us that are still trying to fight the good fight. So please recognize and help us help our community stay safe and slow the transmission by avoiding gatherings. All right. Media questions. With the record number of cases reported today and this week, are we starting to see the effects of Thanksgiving gatherings? Yes, we are definitely seeing the effects of gatherings that occurred the week of Thanksgiving. We expect the numbers to continue to rise over the next 7 to 8 days as we get to that 14-day window incubation period past last weekend. So, by the end of next week, we will start to see the rest of, through the week, and the end of next week is when we will see most of the cases that occurred because of transmission at Thanksgiving. But of course, everyone that got exposed at Thanksgiving that's getting sick now is out there exposing people too. So I don't expect to see a drop off 14 days after Thanksgiving, but I worry that it's just going to continue to spread throughout December, January, February, and of course by then we're going to be in the mix of flu season, so it could be quite a mess. Okay, there are questions here I think I've already covered about the fact that the current stay-at-home order prohibits non-workplace gatherings that cannot facilitate 6-foot distance between people who don't live together. And yes, that includes parades, community events, concerts, sporting events, religious events, weddings, those sorts of things, whether they're small or large. If they cannot permit 6 feet distance among households, they should not be held. And the best way to reduce the risk is to not attend a gathering. So yes, we definitely recommend avoiding gatherings or postponing gatherings to the greatest extent possible, and that includes parades. Let's see, I think that is all. Let's see.
State Health Officer.
State Health Officer, okay. Mark's reminded me that today someone asked about in the media, I guess Dr. Scott Harris, the Alabama Department of Public Health, our state health officer, has also gone on the record recommending that parades be postponed because we have such an alarming rate of transmission going on right now in Mobile County, or in Alabama, and it's also in Mobile County. The other thing that I wanted to comment on, and I'm glad, thank you, Mark, for mentioning the state health officer. Many of you have picked up on news reports that the Centers for Disease Control has recommended 2 additional options for quarantine. So quarantine, remember, is staying at home if you've been exposed to COVID, right? The quarantine duration has been 14 days, and people who were exposed to COVID, who have, or were around someone who was diagnosed with COVID, were to quarantine for 14 days. And CDC has provided 2 additional options, and there has been a lot of press about that. But I want to bring your attention that the state health department is still studying information and supporting documentation that was used to make those recommendations, and they're thinking about those things in the context of what's happening in Alabama. So according to CDC, the 14-day quarantine period is still the safest approach, especially in Alabama's environment of accelerated widespread community transmission. But ADPH is working to make changes to allow the release of quarantine for persons who have been quarantined for 10 days under certain conditions, and that they're asymptomatic and they continue monitoring for symptoms through 14 days. So the state is looking at the 10-day option as long as the other conditions are met, that the person is asymptomatic and that they continue to monitor themselves throughout the duration of the 14 days. They're considering that option in the context of what's going on with widespread community transmission right now. It will require changes be made to current processes and protocols, and they hope to have everything finalized by December 11th next week. This is the current expiration, or the expiration date for the current Safer at Home order. So the State Health Department is working on this and working in coordination with the governor's office to try to issue new guidance, or modified guidance, to right now allow for the option of 10 days of quarantine as long as the person is asymptomatic. So right now we're still under 14 days of quarantine, and then when the new guidance comes out next week, we expect that you will have an option for 10 days of quarantine. And I want to just read this statement from Scott Harris, our state health officer. While we would like to be able to decrease the home quarantine time frame to 7 days for persons who may have been exposed to COVID-19, this is not possible at this time due to a number of reasons, including our high case numbers and the disparity in testing resources among different parts of our state. So the 7-day allowance by CDC, that option requires testing, and the availability of testing is not the same throughout the state. So high case numbers, some limitations on testing in some parts of the state. Those are the reasons why the State Health Department at this time is not considering allowing the option of 7 days asymptomatic with a negative test, discontinuing quarantine. So more on this. You can see the entire news release on our Facebook site, but I just wanted to clarify those things, that right now we're still under 14 days quarantine for exposed. Some changes will be made by December 11th. It will likely include an option for the 10-day asymptomatic option for discontinuation of quarantine. So thanks for your attention today. Be safe out there. Have a great weekend, and we'll talk to you next week.